Good evening, and welcome again to another lecture series. We're going to go ahead and pick up where we left off. Chapter 1, EMS Safety and the Well-Being of the Paramedic, is what we'll look at next. We started our lecture series with the roles and responsibilities of a paramedic, and now we're looking at safety and well-being of a paramedic as well. So what we hope to get accomplished in this particular talk tonight is to list the components of wellness and discuss how paramedics can promote wellness, not only in themselves but within their communities, discuss principles, personal and professional benefits of a positive lifestyle or positive lifestyle choices that promote wellness related to nutrition, rest, exercise, weight control, and not smoking. We'll discuss ways cardiovascular endurance, muscle strength, flexibility contribute to physical fitness. We'll define the circadian rhythm and discuss the impact on those who work shifts and ways to manage that impact. We'll look at risk factors and warning signs of cardiovascular disease and cancer and discuss the role of risk assessments. We'll discuss proper lifting techniques and safety factors related to lifting and moving patients during emergency and non-emergency situations. We'll describe the steps, equipment used to protect yourself from airborne, bloodborne pathogens and other adverse conditions. We'll outline actions that would reduce infectious disease exposure as related to field scenarios and develop decontamination plans for equipment exposed to body substances. We'll list and discuss 3 phases of stress response, factors that can trigger stress response, identify causes, signs, and symptoms of stress, and discuss some positive and negative coping mechanisms that exist. We'll discuss the importance of dealing with stress, describe the critical incident stress management and its uses, the need for availability of mental health professionals to EMS systems. When given a scenario involving a stressful situation, we'll develop examples of positive coping responses and how these could be used both on and off duty. We'll list and discuss Kubler-Ross's 5 stages of the grieving process, describe and discuss the needs that may arise when paramedics deal with stressed patients, families, death, and dying. Now, the concept of EMT well-being begins with wellness. And wellness is a concept that involves physical and mental well-being, as well as injury prevention, as well as prevention of disease and stress management. In EMS, certainly, there are situations where we physically stress our body, definitely situations that stress our mind. There are situations where we can become injured, situations where we can become infected with different diseases, and the stress of EMS can take its toll as well. So wellness, we're going to first look at mental and emotional well-being. And mental and emotional well-being isn't just about sleep and exercise, but certainly good nutrition, which can be a challenge for EMS providers, particularly if you're in a roaming vehicle in a facility. It often or in a big city, it often seems like your choice to have a meal has to be fast food, just because of the possibility that you're going to get an ambulance call. Physical fitness, in addition to releasing powerful endorphins that make you feel better when you exercise, is important to keep those those muscles limber and strong when it comes to having to lift and move patients. One of the things that EMS providers often don't get is sufficient rest, and that's related specifically to shift work. That's related to working a 12-hour shift and then being on call for 12 hours and getting called back in. There are many times early in my career where I'd work a 12-hour shift and I'd get called back in, and I'd work a 12-hour shift and get called back in. There was a period at one point where I'd been up for 72 hours straight, and I really struggle with trying to understand how that's a benefit to our patients. You know, there's all kinds of research and certainly moves within the country to limit ED physicians to being on shift no more than 12 hours. Being able to manage stress, you know, we'll talk about the stress in our lives, in our families, and certainly in our work. As an EMS provider, we are exposed to many different stressful situations, and depending on our coping mechanisms, we may be able to manage that stress quite effectively. But if our coping mechanisms are ineffective, or if we choose to ignore the situation, this stress cumulatively builds up and takes its toll in the form of things like cancer, heart disease, and diabetes. And while there's been a lot of research on, you know, the personalities in EMS and what makes an EMS provider a good EMS provider, in addition to being a type A personality, EMS providers often have you know, addictive behaviors by nature. And you know, certainly when we talk about substance abuse, that can be a problem. Now, wellness includes physical well-being, which has to do with nutrition. And again, nutrition is something that, you know, when I grew up, there weren't labels, there weren't countries of origin, there weren't listings with carbohydrate content and calorie content and sugar content, but we didn't eat a lot of processed foods either. In EMS, you know, one of our challenges, again, as a result of field work and being on the move and go and not knowing when your next meal is going to be, often includes fast food, which is high in carbohydrates and fats. And fast foods, or excuse me, I'll go back to just carbohydrates. Carbohydrates, when we eat carbohydrates, 100% of all carbohydrates are converted to sugar, which, if we need the sugar as a primary source of energy, that's a good thing. You should have at least 45 grams of carbohydrates as part of your daily intake. But you look at what is 45 grams. Well, two pieces of white bread is 30 grams of carbohydrates. And if you look at, you know, many labels, it doesn't take much to get 45 grams of carbohydrates. Fats that we intake in our diet raise our cholesterol level, particularly mono and polyunsaturated fats. And fats are a necessary part of our diet, a small part of our diet. And if we eat too many fats, particularly in fried foods and those sort of things, it can affect our cholesterol level, which can be a risk factor for heart disease. Proteins are extremely important for tissue growth, rebuilding of muscle, you know, those sort of things. And proteins taken with carbohydrates and fats certainly help us level out your blood glucose levels. Minerals include your electrolytes, your sodium, your potassium, magnesium, calcium. All those minerals are essential in muscle movement, your heartbeat, the rate of your heart contraction, the strength of your heart contraction, and those need to be maintained at particular levels as well. Vitamins are essential for normal growth, normal development, and normal metabolism. And then, of course, water is essential for hydration. You know, over 60% of our body by weight is water. It is important to remain hydrated. And we'll talk about what happens at some point when you become dehydrated. Fiber helps control blood glucose level. Fiber helps lower cholesterol. Fiber is a source of water. You know, when we look at celery and lettuce and those things that are high in fibers also have water in them. And fiber does help the bowels move and prevent constipation. Now, your daily consumption of calories is something that in order to maintain your current body weight, you have to estimate your caloric intake per day. And one of the easiest ways, and it's certainly not the most accurate, but easiest ways to determine what your calorie intake has to be every day to maintain your current weight is to take your weight in pounds times 10. And that's the total caloric intake that you need to maintain your current body weight. And there's no secret to weight loss. It is eat less and move more. There are tons of fads and diets and pills and things that people attempt in order to take weight off. But there's no magic. There's no pill. There's no secret. The answer is simple. If you're not comfortable with your body weight, certainly you need to eat less and you need to move more. And knowing if you're a calorie counter and you're happy with your weight, you know by using this formula how many calories you need to take in per day to maintain that weight. It's interesting that just the reduction of 100 calories per day will lead to a 10-pound weight loss. So, cutting out that small packet of margarine, something that easily equals 100 calories. Cutting 100 calories out of your diet per day and not doing anything else but cutting that one thing out of your diet every day will lead to a 10-pound weight loss in a year. So, back to the whole issue with weight reduction. Fewer calories, healthy choices in the food that you ate, and move more. Here's another certainly more complicated way to determine your daily calorie intake, and it's figuring out your basic metabolic rate and then your activity level, and then taking your basic metabolic rate times your activity level, and that'll give you your calorie intake. This is much more concise if you want to know that, and certainly you can Google this and find this particular formula and determine what your calorie intake per day should be. The physical fitness is part of well-being as well, and they talk about getting 30 minutes of physical exercise at least 5 times a week, and if you're part of a firefighter EMS system, often they have weight rooms and those sort of activities that you can participate in while waiting for calls and that sort of stuff. But private ambulance services often don't offer that opportunity. Hospital-based ambulance services don't offer that opportunity. So it becomes your responsibility to maintain some physical activity in your life. When you think about EMS, we get an ambulance call, and we're giving it our all for half an hour, 45 minutes, and then we're done. And we may not get another ambulance call for a day or two. And so if we rely on the activity based around an ambulance call to get our physical fitness, that's just not adequate. The benefits of physical fitness: it helps decrease your resting heart rate and lower blood pressure. It really makes your tissues more effectively use oxygen. So it increases your ability to carry oxygen. It increases your ability to use oxygen. It increases muscle mass. It increases your metabolic rate, which helps you lose weight as well. And face it, when you're more toned and you're in a weight range that's comfortable for you, it improves your personal appearance and self-image. It also helps you maintain motor skill maintenance. It certainly helps you remain more flexible. The amount of physical activity or exercise that each individual should do varies depending on a variety of factors. Certainly your fitness level, how fit are you right now, your age, what medications you have, what medical problems you have that may make it more difficult to exercise vigorously. There's a couple different types of exercises that one can do. There are isometric exercises, and isometric exercises build endurance and stamina in your muscles. They increase core strength and self-control. They help you maintain balance in the muscles, and they tighten areas that have gaps. Isometric exercises builds muscle power and shapes them up. Now, isometric exercises are exercises where you push against an immovable force. One of the certainly more simple isometric exercises is to place your hands together and push them one against each other as tight and hard as you can, which works the muscles not only in your forearms and your upper arms, but also in your chest. Isotonic exercises is flexing or extending muscles against a constant load. And isotonic exercises include weightlifting or push-ups or pull-ups. And the importance of isotonic exercises is it helps tone the muscle. It helps build muscle mass. So a combination of isometric and isotonic exercises are important in maintaining physical fitness. Now, when we think of physical fitness or well-being or physical well-being, we often don't think about rest. But certainly we know that if you're fatigued and you're tired and you're overworked, it's going to increase your response time. It's going to affect your judgment and your ability to make decisions if you're tired. And most experts would agree that you need about 7 to 8 hours of sleep per day. And that can really be difficult in EMS, particularly if you rotate shifts frequently, if you're working night shifts and then you're working day shifts and then you're back to night shifts. That really has an effect on your circadian rhythm. And in this slide, what we've identified is a 24-hour clock from midnight, certainly to noon, and back to midnight. And at 0200, that's when your sleep is the deepest, or when it should be the deepest. At 0430, that's when your body temperature is at its lowest. At 0645 is when you experience the sharpest rise in your blood pressure. At 0730, melatonin secretion stops. At 0830, bowel movements are likely. 0900, that's when your highest testosterone secretion occurs in males. You get up to 2:30 in the afternoon. That's when you're supposed to be at your, your best coordination, your fastest reaction time. You get into the early evening. That's your greatest cardiovascular efficiency and muscle strength. And then when you get into 6:30, 7 p.m., that's your highest body temperature, your highest blood pressure for the day. And then towards the evening, things like bowel movements are suppressed, and those sort of things. And this is normal. This is a normal circadian rhythm. And this is assuming that you're awake during the daylight hours and you sleep during the evening hours. And you can also see then that when you do shift work and you end up being awake all through the night and asleep all through the day, how it certainly can affect your circadian rhythms. In fact, sleep deprivation from working shifts can cause what is called a circadian rhythm disorder. Sleep deprivation leads to irritability, leads to problems with relationship, can lead to illness because it depresses your immune system. It can lead to certainly decreased job performance and depression. It can lead to things like cognitive impairment, memory lapse, impairment in moral judgment, hallucination, increases your risk of diabetes, may cause muscle tremors or aches, may increase your heart rate, also increase your risk of cardiovascular disease. So sleep deprivation is, certainly nothing to, to pass over. And in EMS, unfortunately, because of all the shift work that you may do, and the fact that you may be working 12 hours and doing call for 12 hours and then getting called in the middle of the night, or if you work nights, getting called in during the day, definitely causes sleep deprivation. The consequences of poor health certainly have been, documented. The documentation of the science exists to prove that, the consequences of poor health lead to cardiovascular disease, which is the #1 killer in men and women in the United States today, leads to cancers, leads to diabetes. And some of the warning signs of cardiovascular disease, certainly a narrowing of the coronary arteries, includes ischemic chest pain. Chest discomfort in the center of your chest that radiates to your neck, arms, and jaw. You may have some associated signs and symptoms like nausea or vomiting, sick to your stomach. It may be hard to breathe. You may be lightheaded, unexplained fatigue, and cardiovascular disease, and it can be a consequence of many of the things we experience in EMS. Certainly not only poor health, but lack of sleep can lead to cardiovascular disease. Stress can lead to cardiovascular disease. And it's important that in EMS that if we recognize any of the warning symptoms or the warning signs of cardiovascular disease, that we have that investigated. Now, there are risk factors certainly that you can control, like your blood pressure, like your cholesterol level, your blood glucoses. And you can see in this little circular chart here that, if your only risk factor is high blood pressure, you're 1.5 times greater chance of having a heart attack. If your only risk factor is high cholesterol, you're 2.3 times greater chance of having a heart attack. But if you put diabetes, high blood pressure, and high cholesterol all together, you're 6.2 times greater chance of having a heart attack than the general population. So maintaining good health certainly reduces your risk of cardiovascular disease. Maintaining good health reduces your risk of cancer. Some of the warning signs of cancer include certainly a change in bowel or bladder habits, sore throat that won't heal, unusual bleeding or discharge, thickening or lump in the breast or scrotum, indigestion, difficulty swallowing. If you've got a wart or a mole that's undergone some obvious changes, certainly a nagging cough or a hoarseness, dyspnea on exertion, weight loss, those are all warning signs of cancer. And most cancers can be detected as a result of assessment screenings. And, in EMS, oftentimes we know that these warning signs are present, but we don't acknowledge them because we certainly use the old denial that, well, it can't be happening to me. It must be something else. Obesity is certainly an epidemic in the United States. It's certainly not a pandemic across the whole world. United States ranks #2 in obesity, Mexico #1. And obesity certainly leads to cardiovascular disease, arthritis, cancers, particularly colorectal cancer, leads to hypertension and diabetes, all conditions that, if left unmanaged, certainly can, lead to poor health and even premature death. Now, one way to prevent injury, because we do a lot of lifting as a paramedic, is to know the proper lifting and moving techniques. And certainly one of the things we'll do in lab will include demonstrating some proper lifting and moving techniques of patients. We need to move the load only if it can safely be handled. And, this is interesting when you consider the bariatric patient. We might think of our 500-pound patient that, well, I'll just pick up his arm, or I'll just pick up his leg and I'll move it. Well, the arm or a leg of a 500-pound person can weigh 100 pounds. And if you're overextending yourself to pick that up, you can suffer a serious back injury. So you need to move the load only if it can safely be handled. You need to get assistance when the load that you're asked to lift exceeds what you're capable of doing. You may have to call for lift help. Getting a good footing with your feet shoulder length apart, getting a good balance, a nice wide base of support is important when you lift as well. In this particular position, you can see that prior to lifting the patient onto the cot, they're keeping their back straight, they're bent at the knees, and when you lift with the most strongest muscle in your body, and that's your legs. When you attempt to not bend at the knees and just bend at the waist and lift the patient onto the cot, you certainly can increase your risk of a back injury. Maintaining physical fitness certainly reduces your risk of injury because it keeps your muscles toned and strong. Using proper body mechanics are also critical. It's not always possible because you may find yourself in some pretty precarious situations, in ditches and other situations where you're trying to move your patient. Body mechanics won't prevent cumulative injury, and certainly what I mean by that is, the ability of you as an individual to over time wear and tear your lumbar spine so that you have bulging discs in your lumbar area from constant repetitive lifting. Reduce the load, and we have a variety of tools available to us to help lift and move patients, particularly if they exceed what our lifting capability is, and certainly calling in help to help share the load. I'm going to pause for just a second here. One other key to prevent injury certainly is to evaluate the situation. Certainly if you're dealing with a life-threatening situation, you may not have time to do a thorough evaluation on how you're going to lift or move this patient, but if that's something that you can do, that certainly could prevent injury. Plan ahead. If you know that you're going to transfer a particular patient and you know that they're a bariatric patient, certainly having a plan ahead of time of how you're going to move this patient could prevent injury. Know your limits. If this weight that you're required to lift is outside your limits, then that certainly is something that you need to get help with or use an assisting device. We practice lifting and moving in a coordinated effort by having a person usually at the head or designating somebody to lift on 3, so that at the count of 3 everybody's lifting, and we're certainly able to to better move the patient without experiencing injuries ourselves. Make sure that you've got a good wide stance. Exhale during exertion. Keep the weight close to your body and below your shoulder. Use your legs. Try not to twist when you lift. And change positions and stretch following a particular heavy lift. If trauma is present or suspected, it's important that when we move the patient that we move them on the long axis of the spine. so that we move them, while they're lying flat, more vertically than horizontally. When we're moving a patient down incline or stairs, having two rescuers on the lower part of the stretcher, or two rescuers on the heavier end of the stretcher. And remember that when lifting and moving patients, it's important that we have that one person or that team leader that gives commands. Communicate frequently with your partner. If the load is becoming unbearable and you need to stop, do that so that you can rest or reposition in order to prevent injury. Now, something else to consider related to personal safety is hazardous environments. And certainly in EMS, we do find ourselves in both physical hazards, chemical hazards, hostile environments. What I mean by a hostile environment is high humidity, high temperature, bitter cold. And so certainly, going into a scene, we may not know the environment until we're actually in it. Now, some of the physical or chemical hazards that one might be exposed to when responding to a scene include loud noises. It certainly isn't uncommon after years of loud sirens and loud noises for EMS providers to suffer some sort of mild hearing loss. Radiation could be a hazard. Certainly chemical substances, as in the picture here, confined space, and working around certainly machinery and electricity, making sure that those that are working around the machinery and electricity have the machinery turned off, lockout, tag out, those sort of things. One thing that I know occurred frequently when I was in the military was an annual audiogram and hearing exam to test whether or not we'd had any hearing deficits as a result of being around, certainly howitzers and other large cannons as they went off. If we were around that a lot, then certainly there was a chance for hearing loss. The same can be said about EMS providers around sirens. Frequent being around sirens frequently certainly can lead to hearing loss. If you're a service that finds himself in situations where you go into confined spaces, you need to have additional training and policies and procedures in place when entering a confined space. Same occurs with hazmat. The NFPA ruling on EMS providers and hazmat says that as a minimum, EMS providers need to be trained at the awareness level, and we just find that not to be true. If you show up on a scene where there are contaminated patients and they can't breathe and their eyes are burning, they're going to come to the ambulance and they're going to expect you to take care of them. So I think in Iowa, at least, we train all our EMS providers at the operations level so that we can do decontamination prior to caring for them. If you're dealing with electricity, it's important to lock out, tag out, and that's making certain that not only is the power off, but while you're caring for that particular patient in that area, the power cannot be turned back on. And then there are other specific hazards unique to your response areas. As an example, in the Midwest, because we, deal with a lot of agriculture, grain bins certainly can pose a unique environment or hazardous environment. Manure pits, all these sort of things can be situations that could be hazardous. Hostile environments include incidents on the roadway, heavy traffic, the potential or possibility of being struck by vehicles that are allowed to drive through the scene. industrial response, and probably one of the most hostile environments that an EMS provider will go to, one of the most unsafe environments, is an assault or domestic abuse scene. It's important to have law enforcement on scene in those particular cases. Getting called to bars for bar fights, being around intoxicated persons, you're just never sure, how they may respond to, any sort of appearance of authority. And then special rescue situations and an unknown environment where you really don't know about it till you're deep in it. It's important that when responding to a scene that we certainly anticipate the potential for hazards, and that if it's not something we're trained to do, that we request those specialized resources, those folks that are trained to enter confined space. Those folks that are trained to do high-angle rescue, those folks that are trained on, how to deal with farm implement entanglement and those sort of things. You may have to stage if necessary, and what they mean by that is you may not be able to be directly on scene. You may have to stage so many feet or so many yards away from the scene until somebody with specialized training can get the patient and bring them to you. The unknown, of course, may certainly be your greatest risk of injury. And again, often you may not know that till you're there and you're in it. Infections certainly can affect your personal health, and we'll talk in detail in other chapters in this program that deal with infectious diseases. But we all need to have an understanding of how diseases are transmitted and which diseases pose the greatest concern. There's been a lot of discussion about Ebola and a lot of discussion about chikungunya and dengue fever and those sort of bizarre infections that are out there. And while the potential for those sort of infections are extremely rare in the United States, I think even in the countries where they are present, while things like Ebola carry an extremely high mortality rate, the mortality rate is associated, I believe, with how well infection control is being maintained, the availability of health care for those who become infected, and those sort of things. It's just not likely that we're going to deal with those diseases, even though they're constantly, being discussed. We're more likely to deal with hepatitis B and AIDS, and certainly we know the infection control procedures, standard precautions or universal precautions, glove, gown, mask, warm soap and water, waterless hand cleaner, all those things that will prevent disease transmission. And then should we have an exposure, knowing what to do post-exposure is important as well. And again, I had mentioned we will discuss this in detail in another section of the program. Disease are transmitted by pathogens, and pathogens are bacteria, virus, or fungi that cause disease. And pathogens are a genuine risk to EMS providers, particularly airborne and bloodborne pathogens. These airborne and bloodborne pathogens get into the mucous membranes of the provider, and if enough of them get into the mucous membranes, certainly you too can seroconvert and develop these diseases. And as I had mentioned, the diseases of greatest present concern for healthcare providers include HIV or AIDS, immune deficiency syndrome, or hepatitis B and tuberculosis. But hepatitis B literally is the one we should be most concerned about because it's a very virile virus. Because it is a virus, because all of those are viruses, there's no cure, there's no pill. The treatment is supportive. And hepatitis B, you're 30 times more likely to get hepatitis B than you are HIV or AIDS, and even much more likely to get it than you are TB. Depending upon where you live in the country, these diseases are more prevalent. The Midwest, hepatitis B is what we're most concerned with. Other diseases concerning the paramedic are certainly things like meningitis, and they talk about Staphylococcus or VRSA, and then you've got MRSA, and then you've got SARS, and you've got other certainly infectious diseases that are not real prevalent in the United States, but meningitis is, and certainly hepatitis is. Your best control for personal safety when dealing with infectious materials is universal precautions. We're taught BSI, body substance isolation, and then having an infection control plan, saying that all services are required to have an infection control plan. And the infection control plan outlines not only the engineering controls that are available, like sharps containers, red bags, waterless hand cleaner, goggles, gloves, gowns, mask. Not only those things, but certainly what should happen in the event that you become exposed to some sort of infectious material. Maintaining vaccinations is extremely important to keeping good health. Getting your flu shot every year is extremely important. Wearing the personal protective equipment that's provided to you. Hand washing is the most effective way to stop the spread of disease. And then decontaminating patients who are infectious. Once you've been exposed, and the most important thing certainly is to immediately be able to wash up and then seek medical attention and document the type of exposure that you've had, and based on that exposure there may be prophylactic medications, particularly for some forms of meningitis and hepatitis, that they could start you on that would reduce your risk of catching those diseases. Baseline testing occurs usually at the discretion of the provider. Baseline testing tells the provider whether or not they had the disease before the exposure, because most of these diseases have incubation periods, and if I experience an exposure and I immediately am tested and I don't have the disease, that's a good thing. But if I'm immediately tested and do have the disease, then I got it prior to my exposure. And then follow-up testing to make certain that I didn't seroconvert and develop the disease. Again, the most important way to prevent the spread of disease is to wash your hands and to use standard precautions. Make sure that you get your flu shots, your TB screenings. In fact, most places are required to do TB screenings, if not every year, at least every other year. Wearing gloves, protective eyewear, masks, gowns go a long way in preventing the spread of disease. If we're dealing with particularly a infectious disease like measles, tuberculosis, then respiratory protection is important. Whether it's some sort of HEPA filter in an airmate or some sort of respirator, that's important to prevent inhalation of the small molecules or the small particles that cause the disease. Some of the personal protective equipment, there are 4 levels of personal protective equipment out there when dealing with disease or certainly even hazardous materials. Level D is your uniform. Level C is your things like your PAPRs, your positive air purified respirators, and they include things like your Breathe Easies from 3M that have NIOSH filters. These filters filter out deadly nerve agents and other harmful chemicals, or an AirMate. And an AirMate is a hood that receives air from a blower motor. And the important thing about level C protection is, this will protect you against hazardous chemicals. This will protect you against particulates like tuberculosis and measles, but neither of these protect you in environments where there is no oxygen. If you look at level B personal protective equipment, that includes some chemical protective coveralls and an SCBA. So this particular person has the protection from the chemical protective coveralls and is breathing only the air that's in this tank. So regardless of what is in the room around them, they're only breathing the air that's in the tank. And then, of course, the highest level of protection is level A protection, which is a fully encapsulated chemical protective coverall. And they're still using an SCBA. They're still only getting the air that's in the tank, but now the tank is inside the suit rather than outside. Now, we will have patients that are exposed to chemicals, and it's important that we get them off the patient. We talk about hazardous materials and we talk about decontamination, and there's no secret to decon. You simply need to remove and isolate the clothing, tie them up into a bag so that if they're off-gassing or if fumes are coming off them, that they don't continue to infect or pose a threat to the people caring for the patients. And then wash them with soap and water for 20 minutes. And soap could be as simple as Dawn or Dove or Ivory. And the important reason that we use soap is some chemicals are more persistent. Some chemicals are more oily. And by using soap, that helps break that chemical down. Example is chlorine. Chlorine is a very persistent chemical, and when you get that on your skin or your clothing, just water alone, it's difficult to rinse that chemical off your body. And we're washing these people down with sometimes room temperature water for 20 minutes, and it's easy for them to become hypothermic. So we have to remember to keep them warm once they come out of the shower. Performing a medical evaluation to see what sort of care needs to be provided, and you may need to provide care even before they're decontaminated. Treat and relieve symptoms as indicated, and then document the incident. And then if you yourself become symptomatic, then you've been exposed to the chemical. And we saw this in Japan, where a deadly nerve agent sarin was released into the subway, and the Japanese healthcare providers were removing the clothing of these victims, and the gas was trapped between the clothing and the skin, and as they removed the clothing, they themselves started to develop the same symptoms of sarin nerve agent poisoning. And then again, to protect the spread of disease and your overall health, make sure that you maintain your immunization boosters, and if necessary, take prescribed medications. Now, if you come in contact with blood or body fluid into your mucous membranes, then immediately wash with soap and water. And if soap and water is not available, use a waterless hand cleaner. But as soon as you get around soap and water, wash the affected area with soap and water. Document and report the exposure. Even if you think it's not very significant, it's important to report it, because 6 to 8 weeks later, should you develop signs and symptoms of acquiring an infectious disease, then you've got documented that you had a significant exposure prior to that, and that could be the cause of your developing the illness. It's important that we clean and disinfect and sterilize the equipment that we work with. Try to use as much disposable equipment as we possibly can. That equipment that's not disposable, cleaning it with something like 9 parts bleach, 1 part water. That's an excellent cleaner to kill and disinfect most anything that we're going to deal with. But it's important that if we mix it up ahead of time, that it only lasts about 14 days, and then the chlorine itself is leached out of the water. Now, as an EMS provider, you certainly will deal with death and dying. And the American Heart Association says the survival rate of patients who fail to respond to effective ALS care in the field has never been improved by high-speed, potentially dangerous transportation to an emergency department. High-speed transportation of a pulseless patient persists to a large extent because EMS personnel are uncomfortable to having to stop efforts in a victim's home, and in effect making such a public acknowledgement of failure. So, we don't like to declare people dead in the home. Certainly we're not comfortable in making that decision, particularly with children. So we will rush these patients lights and sirens, and they're not going to provide much more in the home than what we would provide in the field. Many states, and Iowa's one that's included, has a protocol in place that does allow for discontinuation of resuscitation once it's been started by the paramedic if the patient does not respond to resuscitation efforts. Again, as a paramedic, you're going to deal with the death of patients, and that can take an emotional toll on your well-being, particularly if the patients are children or somebody you know. Responses are usually based upon your beliefs and your experiences, and your overall emotional and mental well-being plays a major role in how you respond. If you're emotionally well-adjusted, if you're certainly have no issues of mental health and you're in good physical shape, you may have a tendency to deal with some of these issues better than somebody who is an emotional wreck and physically not in shape. Personalizing the death often increases the difficulty of experience by the paramedic, and certainly what we mean by that is, if you respond to a call for the death of a child, and you have a child at home that age, and you personalize, gosh, what if that was my child? It can have a much more powerful effect on you than if you didn't personalize it. Now, grieving occurs through several different stages, and the two that are most common are denial and anger, and those are ones that you're going to see as a paramedic when dealing with the death of a patient on scene with family present. You may get those family members that deny that they're dead. It can't be true. You've got to check them again, and then the anger directed at you, which should not be taken personally. That we didn't do what we should have done, and we need to do more, and et cetera, et cetera. So those are very difficult things to deal with on scene. And there are a wide variety of different grieving responses that you'll experience based on the age of the patient, based on the culture the patient comes from, and particular religious beliefs, because they all approach death differently, and there is no one expected response. So it's difficult to teach how a paramedic should respond to a grieving family following the death of a patient, particularly that of a child, and this can be a major stressor in itself. Death notification. It's important that prior to notifying the people on scene of the death, we need to determine the relationships of those present and plan for a very expressive and even a possible violent or angry response as a normal response to death and dying. You should choose who should be present when you make the announcement. Choose the location and the words carefully. Use the words, the patient is dead or the patient has died. It's not a good idea to use words like, they've passed on. they're gone. Those aren't words that allow the family members to begin their grieving process. Explain what was done, be honest, and provide medically sound statements as to why you discontinued the resuscitation. And then give the family a few moments before continuing on with any questions or helping them in any way that you can. Offer some assistance about notifying family members or survivors, notifying religious members, notifying the funeral home. Certainly these are things we can assist the family with. Explain the process it will follow as far as removal of the body from the home, and offer support services if they're available. Expect that this process is going to require some time, and so if possible, be able to offer that time rather than run out on the next available call. Mental well-being is tied to physical and emotional well-being, and mental well-being requires you to make good decisions because, again, we often have to make very quick decisions out in the field, and that requires us to be mentally fit as well as physically fit. Now, some adverse effects on mental well-being include things like shift work have an adverse effect on your mental well-being, sleep deprivation, which goes hand in hand with shift work, poor nutrition, certainly stress overload. And to maintain mental well-being, we first need to maintain physical well-being, and then maintain a realistic outlook on your role as a paramedic. We're not going to save everybody. Certainly every day is not filled with life-saving events, but you can make a difference in a patient's day. You'll be exposed to suffering, unhappiness. You'll be exposed to patients during the most darkest times of their life. You'll be exposed to the most horrific things that society has to dish out. But that does not mean your attitude has to take on that same look. Stress can be helpful. That's called eustress. It can be hurtful and affect your performance, affect your relationships, affect your mental well-being, your emotional well-being, and your physical well-being. Some physical signs and symptoms of too much stress include fatigue, headache, insomnia, muscle aches, stiff neck. Mental signs of too much stress: decreased concentration, decreased memory, indecisiveness, your mind racing, going blank. Some emotional signs and symptoms include anxiety, nervousness, depression, anger, and then some behavioral signs of stressing is pacing, fidgeting, nervous habits, crying, yelling, swearing, blaming people, throwing things, excessive eating, smoking, or drinking are all related to having too much stress in your life. Stress goes through stages. The alarm reaction occurs initially when you're faced with a particularly stressful event. Hormones are released in your system that cause your heart rate to elevate, your blood sugar to increase, your respiratory rate to increase, your muscles to tense up. And if we have continued stressor after stressor after stressor, our body attempts to resist that. Our body attempts to trade things off. If we're not able to get sleep, then perhaps we'll find comfort in eating certain foods that we find comfortable, which may not always be a healthy alternative. So our body resists accumulative stress, but only to a point. And at the point where your body can no longer handle the accumulative stress, you go through the stage of exhaustion, where you are both mentally and physically drained and unable to carry on your daily activities. Again, I had said that eustress is good stress. It's positive stress. It's what gets us out of bed in the morning. It's what keeps us going to a job. And distress, that's the negative stress. And that occurs with an accumulation of stress that we don't deal with in a healthy way. and an accumulation or distress can lead to anxiety. Stress-related health problems like heart attack, stroke, diabetes have all been tied to excessive stress. Sleeping disorders, sexual disorders, eating disorders, are all tied to too much stress. Some cause and effects of stress, and there are triggers, things that cause you to be stressed, and it's different for everybody. Something that I may find stressful, you may not find stressful at all, and vice versa. So I can't list the specific triggers because it varies from each one of us. Stress leads to anxiety, and when we're experiencing stress, we have positive coping mechanisms that help address, solve, and alleviate the problem of too much stress in our life. And then we have negative coping mechanisms that, while they may make us at that point in time feel better, they don't really address, solve, or alleviate the problem, and the stress becomes cumulative. Now, we're subject to stressors every day when we go on an ambulance call. We're subject to stressors in our environment. We're subject to stressors with different personalities that we deal for and care for. And we have to develop positive coping mechanisms because the stress is not going to go away. At times, the stress can be so intense that it literally prevents us from performing our job. Now, when we talk about death and dying, which certainly is a stressful situation, people typically go through 5 different stages of grief, not necessarily in this order, and certainly they can come back and go through one of the stages more than once, but they include things like denial, anger, bargaining, depression, and acceptance. And depending upon what stage the patient's family is in, particularly if they're in the anger stage, you may be the butt of that anger. You may be where they unload because you just happen to be there. When you have a patient who is dying, that may be something they want to do. So they may refuse treatment. And as difficult as it is to allow them to die, if they're in their right mind and that's what they want to do, we have to allow them to do that. Patients who are dying and have the opportunity for a specific treatment to keep them alive longer may opt for that treatment. And when dealing with death and dying, it's important that as a paramedic that you show care and concern, and that you're available to comfort those in need. At some point in time, particularly in medicine, a patient will be admitted to hospice, and hospice is an organization that cares for patients in their final days, helps them prepare and get ready for their death, and so patients may be in hospice. When you're dealing with death and dying, the family and friends around the dead patient may not be accepting what's occurring, and they may lash out at you. And I think it's important, as I had mentioned, that if the patient is in the anger stage of acceptance of death, you may be the target for that anger, and it's not personal, and we shouldn't take it as personal. It's their way of dealing with this stressful event. Maintain calm, professional manner at all times in these situations. It's so important that we communicate rather than make assumptions. Make sure that we communicate effectively with other staff, responding members. It's important. And you can have a positive effect on the loss of a patient. We're often asked questions like, did they suffer? And, you don't want to get into the situation where you make statements that are false or that you can't validate and or give the surviving family false hope, particularly if later it turns out not to be. So you can have a positive effect, but only if you're open and honest in your communication and dealing with death and dying. Now, some things to certainly consider about death is how different populations address it. And an infant to 3-year-old, they don't understand death. They're often in a routine, and if it's possible, allow them to stay with their caregivers and allow them to, conduct their daily routine. 3 to 6 years olds, they don't understand death, but they certainly may blame themselves for the death, and you just need to reassure them that they're not to blame. 6 to 9-year-olds, they do understand that the finality of death. They may ask lots of questions, and they may fear loss of others that they love. 9 to 12-year-olds try to act like adults. They may ask lots of questions. They may experience the same 5 stages of grief as any other adult. They may be anger, and they may regress and draw very quiet. The elderly may provide comfort to others. It may, as an elder patient, if one of my good friends dies, I can't help but think, I'm that age, and I'm certainly at a point where that can happen to me. It's just so important when dealing with all people with death and dying that we maintain a professional, supportive presence and can help them in their time of need. Dealing with death and dying can be emotionally and physically challenging as a caregiver. Again, it may trigger memories of your own situation. It's important that you remain as professional as you can and provide appropriate care. And then after the call, certainly deal with the concerns if they exist. Talk to other EMS professionals that didn't seem to be as quite upset as you were about a particular situation. If you suppress your emotions, if you just turn them inside and don't deal with them, that can lead to early burnout, but can lead to critical incident stress, can lead to a post-traumatic stress disorder. It's important that following the death at an ambulance call that you yourself have closure. If you don't maintain closure in this line of work, it certainly can affect your mental well-being. So in summary, an EMS safety includes mentally, emotionally, physically preparing and protecting yourself. Physical preparation includes exercise, proper nutrition, ongoing risk assessment. Eating wisely and well can be difficult as an EMS provider. Maintaining healthy weight can be difficult as an EMS provider, but understanding that maintaining healthy weight contributes to lifelong health, decrease in disease, and also makes lifting easier. Being physically fit decreases injury, increases lifespan, increases your ability to deal well with the physical and mental and emotional demands of EMS. Cardiovascular fitness, muscle strength, and flexibility should all be maintained to help health and prevent disease. Regular dental medical checkups, medical and dental checkups should be part of your process as well. Make sure that you get adequate amounts of sleep and rest. There may be times you just cannot based on the activities that you're dealing with, but as soon as possible, make sure that you get that. Identify and seek assistance and treatment for addictive behavior should you have them. Learn to manage stress effectively with positive techniques. Personal protective equipment is important. It's usually available to you on your trucks, or should be available to you. And as a paramedic, as you're trying to save lives, but you have to deal with death and dying, you have to deal with other personal stress levels, you have to learn to develop healthy coping strategies when dealing with death and dying as a paramedic as well. Remain professional and appropriate with stressed, pained, or grieved individuals. You're going to have some difficult calls, and you're going to deal with some critical incidents that will cause stress. It's important that you're aware of that and that you deal positively with stress, that you find healthy ways to relieve stress, and if it's still bothering you, seek professional help. Death affects individuals in varying ways. It affects varying ages of individuals. And in working with a patient who is dealing with the death of a patient that they may have cared for, remain supportive and non-judgmental. All right, so that ends our lecture here this evening, and should you have any questions, feel free to contact me at that web address. Feel free to message me on the Iowa Western Community College message board, or give me a call at 712-320-8220. All right, talk to you soon.